Hello and welcome to COVID-19 Local Impact on Your TV. I'm Dan Malta from the Your TV studios in Peterborough. More changes to the COVID-19 statistics in the Peterborough area as the effects of false positive tests continue to be reflected in the totals. Now, as we do every Wednesday, we'll bring you the address from Peterborough's Medical Officer of Health. Here's Dr. Rosanna Salvatera with an update from the Peterborough Public Health Unit.
Hello everyone. So our current case count as of 4 p.m. Yesterday is 67 confirmed cases for Peterborough. You'll note that that is lower than last week, and that's because of the event that we had with the lab, and I'll get back to that in a little more detail for you in a few moments. We've got that also up on our screen. I'll just go on because the next, pardon me. No, it's okay. Of those 67 cases, 17 are still active and 48 have resolved. And you'll see that we have 2 deaths. And this is 1 less than last week because of the lab error that occurred. Also on the screen is an estimate of how many people we have tested in Peterborough to date, and we're getting close to 5,000. We're at just over 4,800 people have been tested. Also on this slide, you'll see that we continue to see more females than males identified as cases. Again, that is very much in keeping with what's happening in the rest of the province. And again, we have a wide age range of cases, with the majority of our cases occurring between the ages of 20 and 69. So I could have the next slide. Great, thank you. We have, let's see, I think I'd like to start with the source of exposure. So as of, similar to last week, you'll see that about half of our cases are still related to close contact with a confirmed case. So we are actively continuing to follow up all of our cases and their contacts. You see that that is making a big difference in our ability to contain this disease. Travel is representing 34% of our cases, and our community spread is 16.4%. And that has been adjusted down again because of that lab event from last week. We have six of our cases have been hospitalized, and as far as the community outbreaks, we have no new outbreaks to report. We have 3 ongoing outbreaks: Extended Care Lakefield, St. Joseph's at Fleming, and Peterborough Retirement Residence. We have removed Empress Gardens. That was due to the lab error, and we are waiting for retesting results for both Extended Care Lakefield and the Peterborough Retirement Residence to see if they can also be removed. St. John's Senior Centre has now been resolved. As far as the update on surveillance, together with our healthcare partners, we have completed testing in all 8 of our long-term care homes, as you heard from our board chair, and that includes over 1,000 residents and close to 1,000 staff. We are now testing staff and residents in retirement homes, which is above and beyond what the Premier has requested. We are at a total now of 13 out of our 20 facilities having been tested, and we are on track to complete this by May the 12th. I think that, let's go to the last few visuals. So here you see the corrected cases on the top by reporting date. So, no, just stay on the top one. Scroll up right there. There we go. So you see we tend to get between really 1 case per day. There are some days where we don't get any new confirmed cases. So, and then when you look at the next figure, which is the cumulative cases, you'll see again that curve has been flattened and is continuing to increase at a very slow rate. So with that, I just want to make a few more comments that are pertinent to the data that I've just shared with you. First of all, as far as testing goes, we are testing an enormous number of people in Peterborough every day, and that's thanks to a great part by the enhanced surveillance that we're doing currently in long-term care homes and retirement homes. Each day, there are teams of paramedics and physicians going into these settings and testing all residents and staff. This began in April, is due to end on May the 12th. And we're making good progress. In addition, starting tomorrow, we will begin testing all staff in our emergency childcare centers. And this big jump in the amount of testing that we're doing each day means that we haven't been able to keep a daily count of our numbers. We have asked the province to provide us with a breakdown of the daily testing numbers by public health unit, but until they do, we will not be able to report on the numbers tested daily. That said, we are able to provide the total numbers of positive and negative results as they are being reported to us by the labs, and today's numbers show that we're close to 5,000 individuals who have been tested, the vast majority of them having been negative. Last Friday, we did receive notification from Biotest Lab in Ottawa that 22 positive test results for people living in our health unit had been impacted by a technical issue. You will recall that that's when we had seen that large spike of positive results. So it appears that that spike did not actually take place. We have contacted 21 of those 22 people. One person was deceased. This individual died from another cause, but had been tested for COVID. In that case, the physician has been notified and will be revising the death certificate to remove the reference to COVID. So this death is no longer included, and you'll see that that's been reflected in our total numbers of deaths. There were 4 individuals who have been removed as they no longer meet case definition. One of those individuals had already completed the 14 days of isolation and had been discharged, and that person chose not to be retested given the timing. And then 3 others also chose not to be retested and instead decided to complete their 14 days of self-isolation. 17 of the 22 people have been retested. Their status has been changed for now to persons under investigation, and they are updated as their results come in. So far, only 1 of those has been a true positive. So it's been a busy week just trying to make those changes and to correct our data so that we have it for you today and going forward. And staying on the theme of positive cases, we've recently received questions from local residents asking us why we're not reporting positive cases linked to any specific community or to a workplace. And often these concerns are heightened because of a flurry of circulating rumors that sort of light up social media for that day. And so I thought it would be helpful to explain what goes on when we do receive a positive test result, just to give you some insights as to when we do or don't notify the public. So first of all, when we get a positive result, the first thing we do is to contact the case immediately, and we begin our investigation. Our public health nurses conduct contact tracing, and they determine everyone who could have been exposed to the case during the period that they were contagious. We then identify if any of those contacts meet the criteria for being what we call a close contact. That means that they have additional risk from that exposure, and we follow up with those people directly. Some of those people go on to do self-monitoring for 14 days. Some of them are advised to isolate. And if our public health nurse determines that this case was in a public place or at an event or working, we actually conduct a risk assessment of that setting. If we determine that there is a higher risk to the general public, that would lead to more people either being self-monitored or self-isolating, we actually would issue a public alert to give the residents the information they need to stop the spread and to stay safe. In addition, we are required to disclose outbreaks that occur in long-term care homes, in food premises, if there's been an infection prevention and control lapse, or other settings that we inspect. These are always available on our website by clicking on the link for inspections at the top of the page. And that practice continues even now during the COVID pandemic. But we often do get calls about rumors, and if an individual case chooses to disclose their health status and their testing results, that's their decision. But if public health is asked to confirm when rumors start to circulate, we will neither confirm or deny the positive case, and we will re-emphasize the public health measures that we believe are needed and have been sharing all along. So it's important, I think, for everyone to understand that as a health information custodian, under provincial privacy legislation, I have a professional responsibility to protect the privacy rights of every individual in Peterborough. And so there must be a strong enough public health reason to disclose information that could potentially identify a positive case. As people encounter more rumors about positive cases associated with specific stores or workplaces or communities, I would urge all of us to keep in mind that it's really not helpful to focus on specific locations because the coronavirus can be anywhere. My own advice is to assume that the virus is everywhere, and it's out there. It's usually spread in the community long before we ever find out. So just think of it. Someone who develops symptoms can be up to 14 days away from the exposure that led to that infection. By the time the person is tested, that virus has had plenty of time to be picked up on someone's hands or shared in people's homes. It's potentially long gone from that place and has moved on to another, or actually, in reality, many others. So there is absolutely no reason to believe that you won't encounter the virus at a grocery store when you're out doing your weekly shopping for essentials. I think it's much better and safer to assume that you are up against that virus every time you leave your home, or even better, that you could be incubating and may spread it to someone else. Making those assumptions will be the most helpful to ensure that you behave in a way that reduces the risk, not only to yourself, but to others around you. So stay the distance, wash your hands, and don't let your guard down. Thank you.
We'll continue to have the weekly briefings from Dr. Salvatierra every Wednesday right here on COVID-19 Local Impact. The Haliburton-Kawartha Pine Ridge District Health Unit sent out a media release stating there have been false positive tests in their jurisdiction. The health unit, along with all other healthcare professionals in the area, have been testing symptomatic and asymptomatic residents and staff of long-term care homes and retirement homes as part of the COVID-19 action plan for protecting long-term care homes. Peterborough-Lindsay declared an outbreak on May 4th after a resident tested positive for the virus. Case Manor and Bobcaygeon declared an outbreak on April 26th after 6 residents and 6 staff tested positive for the virus. On May 1st, the health unit was notified a lab error may have resulted in false positive tests for the 12 individuals at Case Manor. They've since been retested and 5 of those positive tests have come back as negative. The rest are still awaiting the results. Maplewood Nursing Home in Brighton has declared an outbreak after 1 resident tested positive for COVID-19. Finally, Adelaide Place in Lindsay had declared an outbreak on May 1st. However, the health unit was advised the positive test from a resident in the home was a false positive test. The patient has been retested with a negative result, lifting the outbreak. And now I'll get you the numbers for Kawartha Lakes. As of May 5th at 9 p.m., 138 confirmed cases, 8 hospitalizations, 103 resolved cases, 32 confirmed deaths. Part of those 3 outbreaks, and in Northumberland, still 13 cases, 1 hospitalization, and 13 resolved cases. An announcement today from Premier Doug Ford. The province will allow garden centres and nurseries to reopen as of Friday at 12:01 a.m. On Saturday, hardware stores and safety supply stores will also be allowed to open, and on May 11th, retail stores with a street entrance will be allowed to open for curbside pickup. Kawartha Lakes is lifting restrictions to some services. Your TV's Mary Tendeshat speaks with Mayor Andy Letham, who lists what services they are cautiously opening.
We're lifting our burn ban effective on Friday this week, May 8th. There is a provincial burn ban in place for part of the municipality. The landfill site, we're opening the Lindsay landfill site as of Monday to full services. No, we're going to have a limited number of vehicles obviously allowed in at a time, and we're going to be in no cash. So it'll be a cashless system put in place. The Fenland and Eldon landfill sites will open the following Monday on the 18th, which is the holiday Monday, which is pretty standard. The Victoria Rail Trail, which we traditionally open to motorized vehicles, ATVs and side-by-sides on May 1st, has been pushed back, and we're going to open that on May 12th. Boat launches, we're working on prepping our boat launches for opening on May 14th across the municipality. I think that aligns well with the recent direction from the province regarding letting marinas get back to work. Eventually, they're going to start releasing some of those boats, so we want to make sure that we're inspecting and getting the proper signage up in our boat launches so we can work along with that. And then the only other one was the farmers markets, which we're targeting a date around not before May 30th. A lot of them aren't going to open on May 30th, but May 30th or after, farmers markets will be allowed to open, but they will have to have a sign off of their plan by the local health unit, which is a provincial requirement that, how are you going to do this safely? Where are you going to have a wash station and such like that? So once the health unit signs off on it, then we'll allow them from a municipal perspective to have it on May 30th or after.
Mayor Letham says there is a reason why the municipality is being cautious in regards to opening services.
It's always a tragedy when people are dying and getting sick, and it's hard for our frontline workers to what they're facing every single day. And I want to be respectful of that when we're releasing some of these services so people can go out and have a little bit of fun.
Over the past few weeks, have you had any issues with motorized traffic on the trails?
We have. We've had motorized traffic, I would say over the last month. With the early spring we had, there was people, as soon as the snow was off, we have our folks that like to get out on the trail. So, we've been trying to sort of give them a friendly reminder that the trail isn't open right now. Obviously, after May 1st, there was a little bit more use, but, our bylaw have been out, the OPP have been great, and even our Kawartha ATV Association has been out at the trailheads, at the road junctions, not on the trail, but at the road junctions, reminding people that the trails, aren't open as usual on May 1st. We haven't had any real confrontational problems, just reminding people that sort of took it for granted they would be open as usual, that they're not. So, we're looking forward to May 12th, and we think most people will do it responsibly, and as long as they follow those distancing protocols, which shouldn't be a problem on an ATV, we should be fine, but we don't want them congregating at some of the trailheads either. So we'll be out in full enforcement on the long weekend to make sure that's the case.
Host of the Queen's Park Report, Ken Tremblay, recorded a full 30-minute Zoom show with MPP Dave Smith, which will air in its entirety tonight at 9 p.m. right here on your TV. MPP Smith says there have been some lessons learned with PPE during the coronavirus pandemic. Here's a sneak peek at their discussion.
With SARS ending, one of the things that was decided on and was a good practice was a stockpile of all of these products. Great concept, come up with a stockpile that was there for pandemic purposes. The problem with that implementation was they never rotated any of the stock through. So we got to a point where those masks expired. It wasn't that the respirators weren't going to work, it was that the elastic bands on them started to rot. So you had nothing to hold that to your face. Moving forward, we're going to have that stockpile, but the stockpile is going to be rotated through. So we'll keep that stockpile fresh, and we'll be distributing it out after a period of time back into the healthcare system. Simple things like that that weren't thought of that will make a big difference for us as we move forward.
Yeah, it's maintenance contracts, it's rubber seals, it's lubricants, it's motors, preventative maintenance, because when you do need it, you don't want it to have to go for servicing before you can put it into, like, yeah, you're quite right. I mean, this is going to really bring some big holes in how we kind of look at all of this.
Once again, Queen's Park Report will air exclusively on your TV tonight at 9 p.m. Another show making a comeback tonight is Politically Speaking. Host Jay Amer talks with Peterborough and Kawarth's Economic Development CEO Rhonda Keenan and President of the Greater Peterborough Chamber of Commerce Stu Harrison tonight at 7 p.m. for a special COVID-19 program. Both shows will be repeated throughout the week. Check your listings for more details. As COVID-19 local impact continues, we'll head down to Northumberland for an update. Welcome back to COVID-19 Local Impact on your TV. I'm Dan Malta. The Northumberland Hills Hospital Foundation wrapped up their fiscal year on March 31st. Foundation Executive Director Rhonda Cunningham tells your TV's Mark Rockburn it was another banner year for the organization.
At March 31st, we had raised $3.4 million. And during that fiscal year, we had celebrated some of our most successful events to date. Our Caring for Generations Society had an extraordinary year, raising $165,000. Our gala was a record-breaking year, raising $570,000. Our Light Up a Life campaign was the most successful campaign on record, raising over $200,000. So, you know, it was a banner year for us, and we raised a lot of money in our community.
In these tough economic times, Rhonda, over the last year, we'll continue on with the last year forecast. What was the success of Northumberland Hills Hospital? Because I know there's lots of organizations out there looking for money. So why is the hospital continually be so successful?
I think the community has a lot of trust in the hospital itself, and they also see the benefit of investing in medical equipment that they will themselves benefit from having access to. For instance, you know, the foundation in the past, we fundraised for things like an MRI, CT scanner, ultrasound units, mammography units. People really value high quality healthcare, and I think that they're willing to contribute towards being able to have access to those services. So I think the other point I'd like to make is that as an organization, we're heading into our 17th year, and there's a lot of people that live in our county who still remember, you know, contributing to the fund to build the hospital and watching the building rise up out of the ground. And there's a lot of pride in our residents. They feel like they built our hospital and they want to see us continue to be successful, and they nurture us. So that fact is not lost on us. We feel very privileged to hold that high level of trust with our community, and we never ever take a donor's support for granted.
I am sure not many things surprises you in this community, but what have you learned during this pandemic currently, not only in your role as the foundation CEO president, but just in general about this community?
So maybe two lessons learned. The first is the power of being flexible and really understanding that, you know, we're all in these changing times together, and to approach it with a thought and an attitude of being creative, as Natasha says, as opposed to the world is ending and, you know, not being flexible. So being flexible is really important. The other thing that I guess I've always known is that this community truly does care, and people care. And if anything, I would say COVID-19 has brought out the best in most people. We're seeing small acts of kindness from children right straight through to seniors. Everybody wants to help, and their biggest challenge sometimes is trying to figure out how to help effectively. And that has just made my heart soar, because it's reinforcing that people really are good and want to help, and it's so nice to be able to see that.
The small but mighty staff at the Haliburton-Kawartha Pine Ridge Health Unit has been putting in long hours and taking on tasks they may not normally do. The health unit's medical officer of health, Dr. Lynn Noseworthy, says she's proud of her team and the work they're doing to bend the curve.
Well, it's been a challenge, to be perfectly honest. We have a very small number of staff within our health unit, and our staff have been reallocated to sometimes to doing work they've never done before. But they've all been trained up to do the work, and we're very proud of the work that they do. And I know that our staff are very passionate about their work in protecting and promoting health within our communities and ensuring that our communities are safe and that people are not getting ill. It's very challenging, though, when we're dealing with outbreaks, when we've had such a loss of life, in particular at Pinecrest, but outbreaks in other facilities, and watching what's going on provincially. It is very challenging. It's very emotionally charged because people who died are people who were loved, had families, friends. And when we're doing contact follow-up, we're dealing with people who may have known some of these people who passed away. So it's very emotional for our staff as well.
What's the morale of staff currently?
I think it's very good, actually, despite the fact that we're all very tired. We've been putting in very long hours. But staff are learning new things. They're very passionate, as I said before, about the work that they do. The information is evolving daily. And just to keep up with the volume of information that we're receiving is a challenge in itself. It's very heartwarming to see people comply with our direction, with our advice, with our staff really stepping up to the plate and working very hard to address the situation. It's also at times very emotionally charged when we find out about outbreaks in long-term care homes and the struggles that long-term care homes face to provide care to their residents, and the fact that some of these residents have actually passed away. So again, it's very, it's an emotional up and down some days. But overall, it's been very rewarding for me as a medical officer of health to see public health in action.
That's the show for today. Tune in tomorrow for another edition of COVID-19 Local Impact. For Your TV, I'm Dan Malta.